Hi everyone, welcome back to episode 2 of series 3 of Probably Nothing. Thank you so much for joining us. My name is Karen, if you didn't know that already, not because I think I'm famous, but some of you might have seen a previous episode. I am the Cancer Information Officer at the Eve Appeal, and I run our Ask Eve information service with Tracy, our amazing gynae cancer nurse. And last year we had the idea to start this Probably Nothing series, so we're on series 3 now. Hashtag oh how time flies, because loads of the kind of calls and emails that we get to Ask Eve are from lovely people that have got a query about their gynae health, but there's so often the caveat of sorry to bother you, it's probably nothing, but. And yeah, most of the time when someone has got a potential symptom, it's always much more likely that any of the symptoms for any of the gynae cancers are something a lot less serious than cancer. But sometimes for some people, that probably nothing does turn out to be something. So we wanted to kind of create this online weekly show where I talk to an expert each episode about a different gynae topic. And hopefully we've kind of created a really kind of warm space where we can share information, get questions that you've sent in answered, and yeah, just kind of enlighten you and make the information about whatever topic we're talking about really accessible. So last week was Cervical Cancer Prevention Week, and I spoke to the wonderful Adriana from Joe's Cervical Cancer Trust. The episode is up on all of our social channels if you want to catch up. And that chat was a kind of introduction to cervical screening 101, to start our little cervical series in honour of Cervical Cancer Prevention Week. So this is episode 2 of series 3, and today we're going to be talking about HPV. HPV stands for the human papillimovirus. I will say no more because I like to think it's all about me, but I do have a guest. So I will bring on my wonderful, wonderful co-captain for this episode. It is Dr. Anita Mitra, Obs and Gynae. Yay! Oh, look
But
at
it's all
her.
about Karen.
It is all about me. Oh,
Well, it is, isn't it, Karen? Because you are the HPV queen.
Thanks, babe. I'm riddled with it, which is okay. And we're going to talk about why it's okay to have HPV. Yeah, you're right. It is the Karen show, but I'm being really gracious and allowing you to share the screen with me. In case anybody's just tuned in and it's like, why is she being so rude? I am very lucky to be friends with Anita. We met at an event and have worked together on lots of different vag-based things and talks and Instagram lives. And yeah, I love her dearly, and I love that I get to bring my gynae friends on to this show and just talk and get in there. And Anita is on Instagram as Gynae Geek and has so many followers. I'm livid, but good for her. She does put across really good accessible information, so of course she's the person I'm going to bring on today, aren't you, darling?
Very true. Yeah, we are very good friends and we just have good banter. So yeah, don't worry, guys. She's not being mean to me.
Don't worry, I'm not bullying the guest. Right, let's do this. So, human papillomavirus. What is it? What is it?
Okay, so it's a virus. So I feel like there's a lot of talk about viruses these days. But yeah, so it's a virus that humans get. And so there's way over 100 types actually. But there's a couple that we call high risk in terms of cervical cancer. So the virus is all over the place. And if it gets to your cervix, then it can cause abnormalities. But I think it's really important to point out at this point, it's not a sexually transmitted infection. So lots of people are really worried when they get their letter, when they've been for their screening about, why do I have this virus? And so I think I want to be really, really clear to start with that about 80 to 90% of us who are sexually active will have had some form of HPV by the time we reach the age of 50. So having the virus is very much the rule rather than the exception.
So it's not at all surprising that you and I right now could have a test and both have it because we've had sexual contact.
Yeah,
not
absolutely.
with each other. So, I've tried and she won't let me, by the way. Not with each other. I just need to point out. I was like, we've had it, haven't we? So it's really
absolutely.
Common.
But this is the thing. Most people probably think that they haven't had it, because you only really find out if you've got it if you happen to have your cervical screening or smear test at that time. So in most of the cases, we get the virus, okay, and it doesn't necessarily have to come from someone else, and it certainly doesn't have to come from somebody else of the opposite sex. So if Karen was lucky enough to, be able to have a sexual relationship with me, we could pass HPV to one another, but you can also get HPV on your cervix from yourself, which actually blows a lot of people's minds. But actually,
that's crazy. So you don't need another person in the room.
Exactly. So there's lots of studies that have looked at the dynamics of the infection and how people get it compared to what kind of virus their partners have. Now, of course, a man or whoever you're having intercourse with could have the virus and pass it to you, but actually just the act of having sex, and it doesn't necessarily have to be penetration either, can actually get the virus up into the vagina and to the cervix. So remember, the cervix is right at the top of the vagina, and so when this happens, most of the time the body's actually able to clear it. So your body's got a very good immune system, very clever. And so, yeah, most of the time it's gone. You don't notice that you've had it. There's no symptoms that you get from having it. There is a small exception to that rule, and I'll tell you in a second. But most of the time you don't know that you've got it. And then if it persists, so if it stays there, it starts to cause the cells to become abnormal. And that is what we're looking for on the smear test. So whether you have the virus, and if you have the virus, then we look, do you have the abnormal cells? Now, I just mentioned about the exception to the rule. The only time that you would get symptoms from having HPV is if you get warts. So there's HPV 6 and 11 that cause warts. Okay, but they are not high risk types. They do not cause cancer of the cervix.
So to summarize that section, so HPV is an umbrella term for a group of a virus that's got loads of different strands to it, over 100 different strands. Most of them won't do anything. Who cares? Some of them are low risk and can cause warts, and then you would know you had it because the warts are turning up. And the high risk strands, how many high risk strands are there?
So some people say 12, some people say 15.
Okay, so there's 12 to 15 high risk strands, which if your body doesn't clear these strands, they can cause some abnormalities to cervical cells, which again, we'll talk about in a minute. So there's loads and loads of strands of a virus. Most don't do anything. Some low risk cause warts. High risk ones you don't know, but that's scary, isn't it then? That is it scary that you know if the low risk is doing something because a wart turns up, but the high risk are sort of you don't know until something's going on. Is that fair to say? See, I wouldn't know right now. Absolutely. If I had, unless I had a test, if I had high risk HPV.
Absolutely. And that's why the screening is so important, because there aren't any symptoms. And the idea is that you're trying to pick up people who don't have any symptoms, who might have a disease, and then so we can detect it before it turns into something nasty. Because cervical cancer is the most severe thing that these viruses can cause, but it causes abnormalities in the cells before it gets to that stage. And actually, cancer of the cervix develops very slowly, so it takes, we say, at least 10 years from getting that first virus that you aren't able to clear to getting a cancer. And that's what makes cervical cancer so suitable for screening, because if you want to screen for a disease, it has to be something that grows slowly, that you can pick up easily on a test and do something about to prevent whatever that disease is.
So when someone now goes for cervical screening, their sample, so they have their speculum, we spoke about this last week, so I know we don't have to kind of recap too much, but sample taken, then when it goes to the lab, it's now since April 2019, it's moved to looking for HPV first, rather than, so basically, for anyone that doesn't know this, and why would you know, because I only found out, because it's my job, your pre-2019, have your sample taken, and your sample was tested for the abnormal cells that Anita is talking about, i.e. cells that have started to change and either need monitoring or interference or treatment, depending on how severe the changes are. Now, since April 2019, that sample is the same process for the patient, but when the sample gets to the lab, it's checked for high risk HPV, i.e. HPV that can do something dodgy to the cervix first, and then abnormal cells afterwards. Is that right? And why?
Yeah, that's correct. So what we do now, it's called the HPV triage. So the way in which your sample is taken is exactly the same. It's just when it gets to the lab, it's different. So what happens is it goes on an analyzer and they look for the HPV in the sample. And so the reason to look for this virus first is to see, yes or no, does this person have the driver for the disease? Okay. And so if it's found in your sample, then somebody will make a microscope slide of your sample and have a look at the cells to see if they're abnormal. Now, this makes a lot of sense because if you don't have the HPV, you don't have the driver for the disease. So in this circumstance, we are checking all the different points of the disease, basically. And so by doing it this way, this new way, it's been shown that we probably can prevent an extra 600 cases of cervical cancer every year, which is a really good number when we think that at the moment we're diagnosing around 3,000 per year. So
Yeah.
my maths isn't that great, but it's quite a big proportion.
Is it kind of like a fifth extra? About a fifth or so extra,
Yeah, that
I think.
good to me.
Yeah, we're
Yeah,
but
it's it's a big
artists,
number,
we're
isn't
not
it?
mathematicians. Yeah. So they're looking for HPV. So is it? I hate saying this, but is it kind of fair to say that before the HPV primary screening came in, when it was just looking at the sample, the cells first, were people getting missed? Was it kind of less effective test?
Yeah, so we've shown that this way is more effective because the aim of the game is to prevent more cancers. So yes, this is more effective because we are not relying so much on something that's so subjective. So depending on what somebody thinks when they look at a sample, we've got a very objective test here. And then obviously when we look, that is a little bit subjective, but it is very strictly regulated. So everybody who does this kind of special examination of the slides actually has very strict rules and guidelines, and there's lots of checking procedures along the way.
And you said that, so first of all, the sample's checked for high risk HPV because that's the driver. Does HPV, high risk HPV, cause cervical cancer full stop, or is it sometimes something else? So I know, I hate to bring it back to me, but my cervical cancer was caused by HPV 18, one of the two highest, like 16 and 18 cause most cervical cancers.
70%.
So that's loads, isn't it? That's such a high percentage of one disease. So, but could you be diagnosed with cervical cancer and then not have HPV? How does it work? Is it 100%? What's going on?
Okay, so this is a really interesting question. So one statistic I want to share with you is that, so you remember I said that at least 80 to 90% of people are going to get HPV by the time they're 50. But the lifetime risk in the UK to get cervical cancer is 1 in 142. So it's much less than 1%. So as you can see, most of us are getting HPV, but very few of us are getting a cancer of the cervix. And so there's a really great virologist who is in Cambridge, who I do some work with in my research world. And so his name's John Dorbar. He's fantastic. And he has this theory that basically HPV doesn't intend to cause cancer. It actually does it by accident. Because remember that if you have a virus, it has to live within a host. The virus can't live on its own. It has to live inside a human, basically, to survive. So this virus is doing a very good job at getting into our bodies. And then because we have very nice cervixes, we let it live there and replicate. And then, it causes the cells to become abnormal. But if it causes the cells to become so abnormal that they turn into cancer, then the virus is risking its own life because then you can't guarantee that the virus is going to continue to be able to replicate. So that's sort of the theory behind it being an accident. Now, can you get cancers which don't have HPV in? Yes, you can. And there's two reasons for this, okay? First, the virus has caused the cancer and then caused the cells to become so abnormal that they are no longer able to support production of the virus. Okay, so that is one way. So it's caused by the virus, but then the virus dies off because it's made the host, so the cervix, the cells of the cervix, to become so abnormal. So that is a possibility. In that circumstance, remember I said that there's about a decade of time in which that virus has been there causing that abnormality.
The
So
whole journey,
with the exactly, and so with the way that we do the screening now, you would have had at least 2 or 3 smear tests in that time. And during those tests, we would have picked up this abnormality and we would have been able to treat it. So to remove those abnormal cells to stop you from getting a cancer. So that is the whole principle of the screening system. Now, the other thing that can happen is that not 100% of cancers of the cervix are caused by HPV. There are a small proportion, okay, that are not related to HPV. These are slightly rarer cancers. So things like neuroendocrine tumors, lymphoma, that might be something you've heard of, that can also happen in the cervix. Cancers that come from other parts of the body, it's very unusual, but
what does neuroendocrine mean?
So it means that this is a tumor that contains glands that produce different chemicals. So it's just a specific kind of tumor. You can also get neuroendocrine tumors very rarely in your appendix, just to give you an example. So they can form in other parts of the body as well, but they're very, very rare cancers. Now, these very rare cancers are not designed to be picked up by screening, and that is whether we're using the HPV screening that we do now or the older style. They're not really designed to be picked up by the screening, and they don't necessarily grow in the same way. They can maybe grow a little bit quicker. And so also we know that these kind of rarer tumors tend to be the kinds that also affect younger people in whom we're not necessarily screening. So it's really tricky, and obviously we would love to be able to prevent 100% of cancers, but it's not likely that it's ever going to be completely possible because we have these very, very rare tumors. But I just really want to reinforce as well that rare tumors are very much the exception rather than the rule.
And that, thank you for talking to me about that, because we've had when it was Cervical Cancer Prevention Week, so you through your Gynae Geek channel and through our Eva Pill channel, we spoke a lot about Cervical Cancer Prevention Week, so we're talking about cervical screening, go for your smear tests if you're able to, and HPV, if your child's, we'll talk about the vaccine in a minute, but get the vaccine if you're able to, or your child's able to, and kind of how to understand about HPV and all that sort of thing. And we understandably had some people messaging us, we both did, didn't we, saying myself or my sister had an HPV negative cervical cancer, and that this new way of testing, or relatively new, HPV first, is going to, they've said in their words, it's going to be missing out the cancers that they had. So for example, somebody was diagnosed with an HPV negative cervical cancer pre the change in the screening program, so she was diagnosed, but she is now saying understandably that if she'd had this new way of testing, her disease would have been missed because it was HPV negative. What I was lucky I was diagnosed at an early stage because I had symptoms. I was too young for a screening test. But what can we say to, like, because I feel, like, we're really open about this sort of stuff. It feels so crap to kind of encourage people to go, and this is a really effective way of screening. This is a more effective, sensitive test. It's a better way of doing things. It will save more lives. And then you get a lovely person come to us and say, but it wouldn't have saved mine because it was the wrong way around for me. What can I say?
It's really tricky. And honestly, I mean, it's something that makes us all feel very uncomfortable, and often it's someone who's very young as well. And when we're talking about cervical cancer, that's particularly emotive because, you know, if the cancer is advanced, then we may have to remove the whole uterus. So, you know, that's going to have an impact on someone's fertility. And what I would say is that the change in the screening has not been done without a lot of research and analysis behind it. I mean, I've been going to HPV and cervical cancer conferences now for about the last 7 or 8 years, and honestly, this is pretty much all everyone talks about. And there are thousands of research articles that have been written. And I also would say that, you know, when it first sort of came about as a way of doing the screening, everyone was terrified about HPV negative cancers. And I remember going to one particular conference where there was a talk about HPV negative cancers, and it was in quite a small little conference room. And oh my gosh, you couldn't even breathe in that room because everyone wanted to go to that session because everyone was concerned. So yes, it's really awful, and it's really difficult because it's not fair to say, well, you know, you didn't have HPV, it's just bad luck, because, you know, it's awful, it's a cancer, it's not a nice diagnosis.
You can't say
but
that
I think
to someone.
that really absolutely, and if this is you, I'm really sorry, and honestly, I mean, it's really devastating. But I think that we do have to appreciate that there is a lot of evidence behind why we should change, because of the fact that we will actually prevent 600 extra per year. But again, I think that's just why it's so important to make sure that we're encouraging people to go, explaining why we do it, and just making it very clear that being negative is more sort of the exception rather than the rule, and that also if you have symptoms, then you should definitely be seeking medical attention. And if you have symptoms, so we're talking about things like bleeding in between your periods, bleeding after sex, any bleeding after the menopause, funny discharge, funny pelvic pain that you can't explain, you know, you don't need a smear test, you need to be seen in the hospital. So a smear test is always looking for people who do not have symptoms. Any kind of screening, whatever disease we are screening for, is meant for people in the general population who do not have any symptoms. So if you go to your GP and you say, I've got bleeding in between my periods, I want a smear test, and they say no, then I'm going to come and shake your GP's hand, because that is the correct thing. They should be then referring you to the hospital.
Yeah, that's such a good thing to also point out, because we fairly often get, you know, like a lovely mum say, you know, my daughter's at uni, she's 20, you know, she's just had some bleeding after sex, and her GP, you know, should I get her back home to our family GP, because her GP up at the uni, you know, won't do a smear test. And I said, yeah, she doesn't need a smear test, she needs a gynae referral. So thank you for kind of reiterating that. It's, you know, smear test, cervical screening is for, you know, everyone with a probably healthy cervix, to see if there's something going on that could develop if not monitored / treated. Again, like I said earlier, depending on how severe the changes are, it's not, you know, it's not to say, hello, that's a cervix with cancer. You need to go to the hospital and see a specialist if you have symptoms. You don't need a general screening test for the cervix. Thank you.
Yeah, and also just really to point out that HPV doesn't cause any cancers of the ovaries or of the uterus. It can be related to vaginal and vulval cancers, but this test is just looking at the cervix, so it doesn't tell you anything about any other part of your gynecological system.
Yeah. And so if someone has HPV, so hello, I've got my result and it says, hi Karen, you have high risk HPV. Do I, and I don't have any abnormal cells, we'll pretend I do in a minute, we'll do different scenarios. It's like GCSE drama, isn't it? Let's pretend. But right, hi Karen,
I know.
Your result shows you have high risk HPV. Do I need to be, like, is that likely if I've, you know, like been having some sex? Do I need to worry? Is it really serious? Because we get people saying, I've just had my result and I've been diagnosed with HPV, and I never want to kind of belittle someone's experience or someone's fear at all, because I would also be worried if I didn't know really about it and had that letter. But I also want to reassure people that if you have a piece of paper that says you have HPV, it's not game over. Don't panic. It's kind of a
Mm-hmm.
it's a little not warning sign, but it's a little note, isn't it, to say, okay, this is going on.
Yeah, and it's good that we know about it so we can actually see if there's anything else happening. Now, 90% of infections are going to clear within the next 2 years. Okay, so that's really important to mention. Now, also important to mention that if it doesn't clear, it doesn't mean that you have something wrong with your immune system. Sometimes it's just that you were unlucky. We're always researching kind of like pick up why some people clear it and why they don't, but we still haven't really got to a good answer for that. Now, there aren't any antibiotics that we can use to get rid of it, because remember, it's a virus. Viruses are very difficult to cure with medication. And certainly don't be doing any kind of like washing inside. It's nothing to do with hygiene. In fact, there is actually some evidence to suggest that people who do actually like wash inside their vagina or douche actually have a higher risk of having HPV. So please just leave everything well alone. Now, often people come and they're like, oh my God, is my partner cheating on me? And oh gosh, I can't believe the number of people that have been told yes by doctors. So that's just not the case. It's nothing to do with promiscuity. And as we kind of mentioned at the start, it doesn't have to have come from your partner. It can come from your own skin. If it's on your vulva, it can be transported up into the vagina and up to the cervix. But also it can come from a very long time ago. So it may be due to a sexual encounter that you had years or even decades ago that is still there. So it's really difficult to kind of know where it came from. So I almost kind of tell people, like, I think we just need to not think about where it's come from, because that can drive you even more sort of crazy when you're thinking about it, because you'll never actually be able to find out. So it's a really tricky one, because a lot of people, there's a lot of stigma behind it. People think that somebody's been doing something wrong, they're dirty or whatever, but it's really not the case.
It's really not. And so just to recap, it can be passed on through any type of sexual contact, including with yourself, so masturbation.
Absolutely. And also, condoms do not protect against HPV. So you can still, even if you use condoms 101% of the time, you can still get HPV on the cervix.
Fine. And fine, that was very assertive. I don't know, I was like, right, fine, okay, good, right, thank you. Now, so I've got the HPV letter, I've got HPV, okay. What happens next? So screening, we spoke about last week with Adriana, is every 3, this is all presuming results are clear. In a clear bill of health throughout your whole cervical screening life, you'll have one every 3 years from 25 to 49, and 49 to 64 every 5. Again, unless there's something that's, that needs monitoring. So do I wait 3 years if I have HPV, or am I seen sooner because I've got a little something going on?
Yeah, so you'll have the test repeated in a year,
Okay.
because we know that there is the virus there. So potentially in a year, is it going to cause the cells to become abnormal? So this is obviously if there's just the virus and no abnormal cells.
Yes.
So we know that you've got the driver for a disease. So is it going to do anything? There isn't any evidence to show that we should be doing it any sooner, because, as I say, it's a very, very slow growing disease. So it's absolutely impossible that you could have HPV with no abnormal cells and then suddenly in a year's time end up with a cancer of the cervix. It just isn't able to act that quickly.
Progress that quickly. So if someone has so say I've got HPV, I go back in 12 months time, so at my 1 year mark where I've had 2 tests now, and it still says, hi Karen, you've got high risk HPV. I still don't have any abnormal cells, but HPV is still hanging around. Would you at this point think I'm less likely than I were a year ago to be able to clear it? Like if it hangs around for 2 tests, are you kind of like, oh, this is clinging on a bit?
Yeah, absolutely. So then we might think, oh, okay, why is it not going away? Do we need to look a bit further now?
But again, key reminder here, like you said earlier, you can't treat high risk HPV. You can only treat the thing that it's done, i.e., treat the abnormal cells of the cervix. There's nothing to get rid of high risk HPV from my system, is there? You can't do anything or
No.
give me anything. No.
You can't do anything. The only thing I would say is that if you're smoking, I really would consider stopping, because we know that smokers are less likely to clear a virus, and so they also have a higher risk of having abnormalities on the cervix. So that's the main thing. You see lots of people kind of saying, I've seen lots of bloggers and lots of people on YouTube saying like how I cleared my HPV or my abnormal cells, but it's really difficult to actually prove that what they did with, whatever smoothies they were having and whatever, exercise and things. It's really difficult. You could be, the healthiest person in the world. You could eat like 500 pieces of fruit and veg every day, and, meditate every day, and, never smoke, and you could still end up with a persistent HPV infection. It's really difficult. So I find it really hard when you see these kind of videos and things online where people are trying to say what they did to clear the virus, because there's not really any great deal of evidence behind it. And even when we've done studies to look at this thing, it doesn't really show anything that conclusive. And honestly, if there was a way that I knew of, that's evidence-based of helping people to clear their HPV, I would be the first person to tell you. Actually, no, Karen would be. We'd be kind of racing each other.
I was like, hang on, babe, we're joint here. You were talking about you then. I was like, no, hang on, I'm here as well. Okay. But Anita, why, so quickly, just going back to the smoking thing, why does, if you're a smoker, why is it harder for you to get rid of HPV? Why are you at a more, like, why?
So we know that people who smoke are less able to clear the virus, and we think this is probably because of the impact that the chemicals from the cigarettes actually have on the immune system. And actually, we know that when we've done analysis of the cervical mucus from smokers, we can actually see the chemicals from cigarettes in the discharge that you get basically in that mucus. And so that just kind of really demonstrates, because we always think of smoking being associated with lung or heart related things.
Kind of think of it like up here, don't you? It's kind of a chest thing, not a pelvis thing.
Exactly, but it gets everywhere. And so it's likely the impact of those chemicals that may change the sort of the environment in the cervix, but also they can have an impact on the immune system. Because just think about, if you've got two people who both get a cough, for example, tends to be often, smokers might be a little bit more affected, might find it goes to their chest much more easily, these kind of things. So it's kind of the same kind of thing.
And okay, so I've got so this time scenario. Hi Karen, you've got high risk HPV. Thanks for coming for your cervical screening. You've got high risk HPV, and then say I have abnormal cells. Does it say you have abnormal cells, or does it say you have high risk HPV and some abnormal cells, or you've got high risk HPV and we think you might have cancer? Like what else will it say?
Oh, that's a good question, actually. I never get those letters. I just get the
Good
results.
for you.
So what does you tell me what the patient letter says, actually. I'm not sure these days.
I'll tell you because I know already. So it will say you have high risk HPV, and then it will say either low grade dyskaryosis or like either, well, some say SIN 1, some say SIN 1,
Okay.
SIN 2, or SIN 3, which I'll get Anita to explain. And then either low grade or mild cell changes, or moderate or severe. So can you just explain like the three stages? So again, this is all pre-cancer. This doesn't, if you get whatever we're about to talk about, it doesn't mean you've gone from high risk HPV that we were just talking about to cancer. All of the words and language and stuff that we're about to use in this next little chunk do not mean you have cervical cancer. They just mean the cells have changed a little bit more towards progressing into the disease than if they hadn't ever progressed at all. It does not mean you have cancer if you have an abnormal result.
Yeah, so 1 in 2,000 abnormal results may be a cancer. So everyone comes to clinic. So when you get the abnormal results, we invite you to the colposcopy clinic. And so pretty much everyone who comes is worried that they have cancer, because yeah, we do use these kind of big words, and I don't know, I think that we could definitely improve the way that the information is given to people. But so you might see the word dyskaryosis written, as Karen mentioned, and so that is a word to describe the abnormalities in the cells. So it just means that they look abnormal. So it's mild, moderate, and severe. So it just means how abnormal the cell looks. So the person who's looking under the microscope is looking and seeing, do the cells all look nice and uniform, or are they looking a bit sort of craggy is not a very good word, but there's something that's funny looking about them. You can see that the nucleus, which is a kind of control center of the cell, looks very different. You can tell when a nucleus is very active, and remember that cancer cells are rapidly producing. So when they are becoming mildly abnormal, they start to produce very, slightly different proteins, and that's what we're looking at. So the cell itself looks different, and the nucleus will look different. And so the person who's looking at it will decide how abnormal it looks. So generally speaking, mild, moderate, and severe correlate with what we call CIN 1, 2, or 3, and that is a grading system to talk about how abnormal the cells are.
And if there's another episode coming up where we'll kind of go more into like the grades of changes, but just quickly, if someone has low grade changes, then it's likely they'll revert back to normal.
Yeah, so they're very likely to go back to normal, and generally speaking, we will be observing you. We wouldn't normally be offering any kind of treatment if they are mild when we look on the colposcopy, because that's the important thing to mention, is that the reason we ask you to come to the clinic is we can evaluate further to see what's actually going on the cervix, because that's again another form of investigation, making it a bit more accurate to make a diagnosis. Now if they were sort of more if they were sort of more on the moderate to severe side of things, then that's when we start to think this is probably someone who's going to benefit more from a treatment, because they're less likely to go back to normal on their own.
And say I had moderate or severe changes, had them removed. Now, how is it likely? So I've had my high risk HPV, I've had the cells that have changed over the 15 years since I became sexually active, and they've got moderate changes, had them removed. Is it likely that I'm gonna, like, does HPV kind of, sometimes you clear HPV, as you've already explained, but say I've had it worse in that it's developed into some moderate/severe cells. Is it likely at that point that like my body's going to get HPV again more easily than say you who've never had abnormal cells? Or do you think I will find that because I've had it enough, and I hate that sort of basic language, but you know what I mean, I had it enough that it's something to my cervix? Is it more likely that like will I see you again in a couple of years, will it all over again because my body can't clear HPV? Is it kind of once you've got it, you'll probably keep getting it, or it's just bad luck if you have it sin 3 once sort of thing?
So we know from the data that people who have had treatments for their cervix, so people who've had the kind of more severe changes, are more likely to get abnormalities again in the future. And this is probably because, for reasons that we don't understand, some people just aren't as good at clearing HPV as other people are. And so that's really why it's so important that we continue screening. But one thing I would say is that having had abnormal cells removed before doesn't mean that you're going to get it any quicker next time. And that is why we again stick with the same screening timing, because of the fact that it's still developed in the same way and it's still slow. It doesn't mean it's more aggressive or any quicker.
So if you have high risk HPV and have needed treatment for abnormal cells, it doesn't mean that you're going to need treatment again much quicker, but it does mean that, please, just because you've had your abnormal cells removed, it doesn't mean you can then ignore your future screening appointments because you think, oh, well, I've had that sorted. It can happen again and is a bit more likely to happen if you've already had it than to someone that has never had it before. Is that fair to say?
Yeah, absolutely. But also a lot of people who've had treatment before will never have an abnormal smear again. So it's very difficult to know.
Of course. And okay, so we're coming to the sort of last bit now. I've kept her for a lot longer because I can't stop talking to her because she's my friend. Okay, so the vaccine now, so it used to be girls aged 12 to 13. Basically, in the autumn term of year 8 is when you kind of get your first dose of the vaccine. If you/your parents decide you want it, we hope you do. We support the HPV vaccine very much. now boys are offered it because, you know, orifices get HPV and things can turn, you know, a little bit sour in, you know, cervix, in anus, in all sorts of penis places. But cervical cancer is the most common cancer caused by HPV, but it can cause, like you said, vulval, vaginal. So by all children being vaccinated, regardless of gender or regardless of genitals, you're protecting yourself from much more and others from a lot more. Is that fair?
Absolutely. Yeah, and so little factoid for you.
Love
HPV
it.
actually causes about 5% of all cancers worldwide.
That's
So
quite a lot,
that's quite a lot.
right? That's a lot.
Yeah, absolutely.
Yeah.
Yeah, so you mentioned most of the others, but yeah, cervix is the most common. And also I think it's really important to mention that cervical cancer is much more common in the undeveloped world. We're very lucky that we have screening, and in many other countries. I remember the first time that I saw cervical cancer was when I was on my medical elective in Fiji. And so there's no screening, or certainly there wasn't then any screening there. And it was awful. It was somebody who was in her 30s, and she had a cancer that was the reason that she actually came to hospital was because she wasn't passing any urine and she was becoming very unwell. And the cancer had basically spread all the way up to her kidneys. And so unfortunately these kind of things are so common, so that's why 5% sounds a lot, but that is why it's about all about the global number.
And can you just explain a bit about so we'll just it's obviously great that all kids are offered the vaccine, but we're talking about gynae anatomy, so we won't talk about the penises that are vaccinated. But if so say I've got a 12-year-old daughter, had the vaccine, fantastic. Does that mean that she can't get, have I now protected her from cervical cancer?
Yeah, you have to a very large extent, but we cannot 100% say that that person is, not going to get cancer, because of the fact that there are other kinds of virus that could cause a cancer that aren't included in the vaccine. So the current vaccine protects against 4 types of HPV. There's 16 and 18, which cause 70% of cervical cancers, and then 6 and 11, which cause warts. And so we know that it's very effective, but we do know that people who've had the vaccine can still have abnormalities of the cervix because of the other kinds of HPV that can affect. Now, I think that the vaccine that we have at the moment is good because you also get some cross-reactivity with some of the other high-risk subtypes, because HPV 16, so its genome is quite similar to HPV 31 and 33, which are also high-risk subtypes, and then 18 is very similar to HPV 45. And so we have seen from the data that there is a little bit of cross-reactivity. But now, in the next few years, we're going to get an even better vaccine, which protects against 9 types of HPV, which is probably going to be able to prevent about 90% of cervical cancers. So even with that newer vaccine, it's not 100%, so we will still need to continue the screening. It may change in the future, but certainly at the moment the data shows that we do still need to continue screening people, but we do expect that the number of HPV related cancers will fall over the next few decades. And actually also by vaccinating the boys now, we know that over the next 40 years we're probably going to be able to prevent a further 30,000 cases of HPV related cancer.
That's brilliant, isn't it? But at the moment, if you've had the, well, actually ever, because you said nothing's 100%, but if you or your child has had the vaccine, still attend, if possible, the screening appointment when invited, because it doesn't cover all high-risk HPV strands. Interesting factoid for you. So I had HPV 18, and you said it's similar to 45. In one of the checkups, I had HPV 45.
Oh, well, there you go.
That's fascinating. No one, imagine if someone just tuned in now and I'm like, and I had that, and then I had that, and then I had that. Now, listen, so if someone has had the vaccine, they still need to go for their screening. Great.
Correct.
Please do. Now, I say someone missed the vaccine at school because they were, say, 6 months too old, or they were ill when the vaccine was being done, or their parents said no, and now they're an adult, they want to. Like, hello, I'm a 25-year-old woman. can I have the vaccine?
So it's not available through the NHS vaccination programme, but it's something that you could have done. Unfortunately, you would have to pay for it, but there are a couple of reliable services that do offer it. So I think some of the big pharmacy companies, like high street pharmacies, will offer it, or through a private GP or private gynaecologist. So it's something that you may want to get, and lots of people ask me about this question. Now, I think a few important facts here. It may be less effective when you've had it as an adult because of the fact that your immune system may have already been exposed to the particular kind of HPV that you're being vaccinated against. So yeah, maybe less effective, but could have some effect. And I think the other thing to mention is that what was the other thing I was going to mention? Oh yeah, that's it. People are always, sorry, blonde moment. No offense, Karen.
Oi, watch it, woman.
No, people always say, I've had an abnormal smear, so I want to get the vaccine, but do I need to wait for my smear to go back to normal before I have the vaccine? So the answer is no. There isn't any evidence to show that you need to wait to have a clear result. You can have it any time.
But are people able to get it up until the age of 18 on the NHS? Or is it kind of once you're past the 12, 13 school thing, then you have to go private? Or can you get it up until you're 18?
There is a catch-up program. I have to admit, I can't remember what the age is, and I think it might be different in different areas. So we should check that out and let people know.
Yeah. But basically, if you're an adult, haven't had the vaccine, it could offer some benefit, but there's no guarantee because you may well have already had some sexual contact.
Yeah, absolutely. And there's quite an interesting study that's going on at the moment looking at whether it's effective for people who've had abnormal cells removed, because as I said before, they're potentially more high risk of getting the virus in the future. So that's the study that's going on, and I think that's going to have some quite interesting results, and that may be a way that we actually change our practice as well in the future.
That's a nice note to end on, primarily because we've gone way over how long we normally said. So I've just said whatever came out of your mouth in that last sentence, I would have said that's a gorgeous note to end on, Anita. Like, thank you so much for ending on a really powerful and inspiring note about the future of HPV, because I have to finish the show now. Can you please say 3 like spicy soundbitey things that if people skip through the rest of our gorgeous friendship reunion, 3 things about HPV and cervical cancer prevention that you would like people to take away with them?
Okay, the things I would like people to take away. So number 1, anybody can get HPV, and probably most of us will. It just happens that some people will find out about it because they happen to have their cervical screening at that time. 2, it doesn't mean that anybody has been unfaithful. It's nothing to do with being promiscuous. It's nothing to do with being dirty. And 3 is that whilst most of us will get the virus, very few of us will get cancer, but it's still very important to take part in your screening.
Oh, isn't she gorgeous? Dr. Anita Mitra, aka Gynae Geek, thank you so much for that brilliant chat. I loved it almost as much as I love you.
Oh, thank you so much. It's been a pleasure. I hope everyone enjoyed it, and let us know if you have any questions, because there's always something else that we can find in the back of our little heads to inform you with.
Always, always, always. Thank you, my dear. See you later.
Thanks. Bye.
Oh, I adore her so much. Thank you so much for watching this episode, which was number 2. Oh, number 2, poo. No, Karen, you're not a poet. So that was episode 2 of series 3 of Probably Nothing, all about HPV with the wonderful Anita, aka Gynae Geek. Thank you so much for watching. We'll upload this episode to our social channels so you can catch up whenever you like. And next week, the 2nd of February, I'll be back for another episode on cervical screening. In the meantime, if you have any questions and want to talk to Tracy or myself about anything you've heard about during this session with Anita, or anything to do with any type of gynae health concern you may have, we're always available on nurse@eveappeal.org.uk. So we're back next Tuesday, 2nd of Feb. Until then, stay safe.